All right, with me today is Catherine Ducommun. She is a a Swiss-born and trained physician. She's a specialist in psychiatry and psychotherapy of children and adults, and a family therapist who specializes in contextual family therapy. She's a clinical associate professor at Drexel University in Philadelphia, now taking a kind of a lesser role with them. She's also the president of the Institute for Contextual Growth, incorporated in Glenside, Pennsylvania, which was founded by her late husband, Ivan Bozormeni-Nagy. Catherine, I'm so happy to have you here with us today. Tell me a little bit about how you came to know contextual family therapy.
Okay, so it started in Switzerland. Actually, I met Ivan Vasminaj with my late husband in 1980 in Lausanne, Switzerland. And the context was that I was in training for not just psychiatry, but in Switzerland, there's a requirement to be trained also as a psychotherapist. And at that time, the only offer was individual therapy based on a psychoanalytical model. So I was treating a woman who was married. She had a child. She didn't feel like that she was a parent. She had a very blocked notion of her as a parent, although she was totally appropriate as a parent. There was no neglect, no nothing. Our interpretation was that since her father had divorced and engaged in a relationship with a woman of her own age, that it reactivated a sort of Oedipal jealousy. And so I was working with her in that direction with no results, basically. So eventually, she didn't make any progress based on this hypothesis. So eventually, we decided to meet the family. And I had seen the family maybe twice when I heard that Ivan was in, I will use his name as Ivan for me, it's easier, was visiting in Lausanne, and that the institute where he was invited, which was the first institute of family therapy, in one of the very first in Europe, just opened. In those years, there was really nothing much as family therapy in Europe. So I was invited to present his family to him, and he immediately noticed something totally different, which was that her mother was a survivor of the Holocaust and had sacrificed all her Jewish, traditions in her marriage with this Swiss man. So in a way, she was the only survivor because she could get to Switzerland. She got married, and so she was very grateful for that marriage that has salvaged her from death, basically. But at the same time, once she got abandoned by her husband, she was very guilty for having abandoned her Jewish traditions. And Ivan pointed out to that, and saw that in some ways, by not by telling everybody that she was functioning as a mother, this young woman was giving her mother a chance to do something and overcome a depression by becoming active as a grandma.
Mm.
So this sort of reversal of, uh, it would say, psychodynamic suddenly not working, suddenly to discover a totally new path to look at this family based uh, on the idea of loyalties and how to work around loyalties, to me was a real conversion. It really, I mean, I left that presentation thinking, okay, now I have to go in that direction.
Yeah.
So
So,
that was the first
so
step.
it sounds like your example is kind of leading into kind of my next question, which is what is the essence of contextual family therapy? Like, how is it typically practiced? What is it good at?
Right. So, I mean, you're asking many questions at the same time. Let's try to look at it a little bit slowly. So basically, if you look at contextual therapy, also, contextual family therapy, contextual therapy, the name was first contextual family therapy and left to contextual therapy for a reason I'm just going to mention. So basically, so my husband was one of the pioneers of family therapy, was very interested in system theory because all pioneers had to find new tools, that individual therapy was not responding to the question of how to understand family relationships. So he was part of that movement. But what was particular on his case was that somehow he felt that too many of the pioneers of family therapy had abandoned individual determinants, that they didn't think anymore about biological determinants, they didn't think anymore about psychological determinants. And so that was something he wanted to maintain. And in addition, he felt that there was another determination, the determinant of human behavior, which is an expectation of fairness, of reciprocity and loyalty. And that he wanted to really give a place to in his model of therapy. So in the end, uh, and then he named that kind of determinants as relational ethics. So he introduced a model that was multidimensional with a place for biology, a place for psychology, a place for transaction in the regular family therapy model, a place for relational ethics, and also a place for something that he described as the ontic dimension of relationship, which is our definition of the self that is relational. You can say no self without another, and no other without a self. So, or no I without a you, and no you without the I. So that, in that sense, also a notion of autonomy that is relational, that you cannot be autonomous in an abstraction. You have to be autonomous within a relationship. So this was the core of what he brought to the field of family therapy as this multidimensional model of family therapy.
That
So
was
one,
and that there was a specific. I remember one of the textbooks I read when I was growing up in the field was Between Give and Take, kind of this. That really sums up the relational ethics piece that you're talking about. Is that right?
yeah, I mean, basically,
I have an obligation. If I'm taking, I also have an obligation to give.
well, that was an interesting turn because Between Give and Take is rather old, it's 87. And somehow it developed from a notion in those days, if you want to say that, of trying to balance a ledger of give and take, trying to see what one has contributed to, what was would be obligated to reciprocate, and a sort of a notion of obligation of balancing these ledgers. But this notion of ledger is a big problem, that it implies that we could define what is given or what is received in a more absolute way, on an objective way. And in fact, the definition of what is fair or not is relational, because, for instance, I can make a huge gesture to you that sounds benign to you and trivial, that for me is a big sacrifice, for you is trivial. And conversely, I can see that you gave me something enormous when for you it was trivial. So then from that notion of ledger, it moves more towards a dialogue about what is fair and unfair. And also another notion, which is the called constructive entitlement, meaning that the gesture of giving brings something from the act of giving that is a sort of increase of self-value, from that sort of increase of humanness by the giving, an increase of also self-esteem, an increase also of sort of something that is a inner gain. So that's what he described as the constructive entitlement. So eventually, rather than focusing on rebalancing these ledgers, was an approach that helped people to get the opportunity of gaining this constructive entitlement by making a gesture. So the mutuality of gestures rather than a rebalancing of ledgers.
Yeah. You used the term trustworthiness.
Mhm.
How is that term thought about? Is it how much can I trust my partner or the people in my family? Is it about that, or is there another dimension to trustworthiness that you're talking about?
Well, the problem with trust is that it's a psychological element that can be modified because of your own inner psychological work. For instance, you can be paranoid and not trust anybody, or you can be the victim of a crook who makes you give your all your money to him in good faith and trust. So in that sense, the question is then trust is a psychological factor that can wax and wane when, like, some people are able to trust, some people are not. Trustworthiness is really based on relational ethic in a sense of that it's that the person has displayed actions that shows that this is a person that is trustworthy. So the fact that it could happen that you don't trust a trustworthy person or you trust a non-trustworthy person. But for relationships and family relationship, what counts is the trustworthiness.
So being able to be in relationship with someone that I can count on.
Exactly. And being offering also to be available to the other, the commitment to be there for the other.
Yeah.
So
I,
it's really trustworthiness is more in the field of commitments.
yeah. Can you talk a little bit about an intervention or a way that a contextual family therapist might engage a client, a couple, a family around this idea of give and take?
What? So basically, now we come even to the notion of parentification. So basically, and that's my take on contextual therapy in a very shorthand.
Yeah.
It is that what the aim of contextual therapy to help parents give more to the children than they suck out of them. So when you can put the flow towards the children rather than the pumping station from the children to the parents, you have done your job as a contextual therapist.
Have you seen that? Do you have an
Yes, so
analogy?
basically, let's come to that. So basically, the notion of parentification, which is very common in family therapy and structural family therapy, in structural family therapy, it's more seen as a reversal of positions. You know that in the hierarchy of the family, the child takes the place and the role of the authoritarian, and the parent or the child that is sort of ordered around, if you want to say that. Whereas in families, in contextual therapy, is not so much that kind of position, but it is really with giving and with taking. And the order of giving and taking should be that the parent gives and the child takes, not that the child gives and the parent takes. And that's what we call parentification in contextual therapy. So in that sense, then it leads to something that is called destructive entitlement, which is that the person who has been wrong in that way then has a tendency to ask for compensation from other people. So, in many cases, the notion of parentification is linked to destructive entitlement, meaning that parents who have not received in the growing up what they deserved might turn to the children to get it. It's mostly children. I just want to add this because in couples, it happens a lot. But in couples, if your spouse asks you to be the parent they never had, then at some point you say, thank you very much. I didn't make you. I'm not your parent. Go and see somewhere else. So, whereas children cannot do it. So, I could give you a very quick vignette of that way of intervening in such situation. Would that make sense to
Yeah,
you?
I'd love to hear that. Thank you.
Okay. So, here is the situation of a little boy, which would, I mean, not, I mean, like 10 years old or something, with a conduct symptoms of conduct disorder, very aggressive, very not accepting responsibility, hitting other kids. So, roughly speaking, the packet of not caring about others, if you want to say that, with problems at school, problem at home. And this family comes to consultation with my husband. I was the interpreter. The family arrives with the kid with the problem, his little brother, the father and mother. And at the very onset of the session, my husband asks this person, the mother, yeah, we know that your kid is creating a lot of problems, but do you have an example of a time when he also tries to help? To sort of bring something positive towards the child, to be partial to the child. And this child is sitting on the mother's lap and caressing her cheek very, very kindly. Through this boy who was sitting on her lap, she said, no, never. And I even to pay him when to make him stop bothering us. And it becomes grotesque. So any stupid family therapist first minute would say, yeah, ma'am, don't you see that he's trying to help you right now? Well, the problem, of course, if she cannot see it, is that she's blind. It's so grotesque, that even the secretary, the guy who was taping the interview would see it. So the question is not to say that because that doesn't help. So immediately, if she's so blind to the child's contribution, what has created the blindness would have been something that had happened in her own life where people did not see her contribution.
Mm.
And so he asks her, did it? So instead of underlining the behavior, which would be the trap, he just comes back and says, does it ever happen to you that in your childhood that somebody didn't see what you were trying to do to help? And then very spontaneously, she comes with the idea that yes, and she gives a very detailed situation where she had tried to help her mother and she was criticized instead of being recognized. And interestingly, strategically, it doesn't say, oh, now you see what happened now in the situation. It totally refrains from pointing out to anything. He has given partiality to her for her own story. He just asks the child, he said, did you listen to what your mom had said? He answers yes. But again, very, very non-intrusive, no going back to it. Do you realize? Do you see, etc.
Right.
Inlay, after a few minutes, the child is relieved. I mean, his child is relieved and just go play with the brother and finish a drawing and then brings the drawing, looking at his mother with the drawing. And then he asks, "Oh, so your child is doing this drawing. Uh, do you want to take it?" And then she sees that she accepts the drawing, and she said, "Oh, it's nice." So basically, it's based all on actions. That he doesn't go for insight, but when the kids come to the drawing, now she is able to recognize his contribution. So this is just the sort of, and then just very quickly about that. So then she started to talk about the birth of this child and that she had really suffered in her childhood, that she had a hard childhood, and that she in fact saw him as a savior. And then you see how much the burden was as an enormous parentification. He was the eldest. And then the destructive entitlement coming from the child that he's asked too much and then he refused to give or he wants to take from others. So then you see the two generational or three generational results of this not being recognized as a child, not receiving enough, and the child and taking it from the next generation and how to reverse it.
Yeah, yeah. Thank you so much for that example. Um, I guess part of what I'd like to know, before we wrap up our interview, where has contextual family therapy taken a hold in the world, or what do you see as the future of contextual family therapy?
So maybe there was actually an earlier question that you had asked about the specificity of contextual therapy. So basically, the advantage of contextual therapy, because it will imply its future also, is that it's a multi-dimensional model. So when you're a contextual therapist, you are supposed to not go diving immediately into the dimension of relational ethics, but also looking at the other dimension. What could be the ingredients in the other dimensions? For instance, if a child has a physical handicap, it could contribute to his destructive entitlement, for instance, and also the psychological equipment as to being able to trust or not to trust, this kind of thing from a psychological point of view, and also all the richness of the systemic models, which are talking about, uh, all this transactions that are described in classical systemic therapy is also important to take in account. So a good contextual therapy should be able to evaluate the family according to those five dimensions and then see what could be his contribution or her contribution as a specialist of relational ethic in that situation. So that would be the purpose, and then solving issues that, of course, have to do with the basically the speciality of contextual therapy could be understood as the expert in the relational consequences of injustices. And that would apply not just to families, it would apply also to society. And it's not limited to one specific group of people, and so this would be then the main contribution of contextual therapy would be to be expert in the negative consequences of injustices. Could be situational injustices in the world, the consequences of a catastrophe, the consequences of the war on relationships, or the consequences of relational injustices on relationship, being, for instance, parentification as a form of relational injustice.
Mhm.
So that would be the sort of bucket. So then bring to the future, I will talk about the world, where it is known in the world later, but as far as the future, because it's a multidimensional approach, it does have a framework for all the progresses of, say, neurosciences, for instance, or genetics, because some classical family therapy, which has totally dismissed biological factors in their view of pathology, for instance, and just look at systemic feedbacks, etc., without any consideration for the individual characteristics of the family members, then they are much less equipped to bring in these different uh, contributions of the different kind of sciences. So I think for that purpose, contextual therapy is quite well equipped for the future.
Yeah. As far as, one of the critiques that people often levy toward or lay against any kind of theoretical orientation or clinical theory is, is it a one size fits all? Does this, are there, does this only work with a certain population, or has it been shown to be adopted well across the world? Can you talk a little bit about different cultures that are kind of gravitating toward contextual family therapy?
Okay, so first of all, just as a note, you have talked about my own, professional paths. I've by now taught in 25 countries, from South Chile to Mongolia, India, North Africa. I don't have much experience of South Sub-Saharan Africa,
Mhm.
but North Africa a lot, and also different religions for that purpose. So I think that based on the notion of relational ethics, it's rather universal. It's actually that question of injustices plays a role in relationships wherever you are born in the world, basically. Now, how do people deal with injustices is different. If you have bending your faith, if you are the faith in God that will restore injustices in the future, in paradise, or has tested you by having hardships in your current life, or is it karma and past reincarnation? So the explanations for injustices and how to deal with it may vary, but in general, even with those explanations, people have left over of the result of injustices that shows up in relationship pretty much worldwide. Does much depend on the culture from that point of view. So on that basis, in my clinical experience of teaching worldwide, it has been it applies. It has not a real limit. Now, the next question is contextual therapy known worldwide or used worldwide? And that is more patchy because they are, even in America, is not one of the most known approaches, and unfortunately known too much through the older writings, and including this notion of ledger that has been gone for a long time. So I would encourage, whoever is watching this tape to really look into the most recent literature. But as far as how it is known, I have there is a website in Holland. So I would say Holland and uh, Belgium had been in Europe the places where there are the most contextual therapists because my husband taught there for years since the late 60s. So there is, for instance, an association of what they call contextual workers, which includes people who are inspired by contextual therapy in their social work or educational work or whatever, or pastoral work even, and actual family therapist, contextual therapist. And the association just for the two countries, about 400 members just there. So
Oh, yeah, great.
otherwise, speaking of this woman, I could give you the references later, was kept a website including all the possible publications in contextual therapy. There are actually uh, 150 entries pertaining to contextual therapy and translation of my husband works and his colleagues as to writing on contextual therapy and over 1,000 secondary entries on contextual therapy. So it's people don't realize how much that is.
Yeah, it's one of the models that when I read about it, I get very excited about it. I don't identify as a person who practices from the model, but it makes a lot of intuitive sense, and I love the fact that the core ideas in the theory can be scaled up to think about relationships beyond just the family unit. Catherine,
And yeah,
I
just to
appreciate.
finish one word about this. This is why the abandonment by my husband, which was maybe wise or not wise, of the word contextual family therapy, because it does apply to other situations than family therapy. That's just I wanted to add that.
Yeah.
Now,
Well, Catherine, thank you so much for being with us today and agreeing to be interviewed. I know a lot of people are going to benefit from hearing about this contextual model that is just a really solid piece of thinking, but is not a lot well known necessarily here in the United States. So I'm glad to be part of this. You wrote recently, and I'll put this in the little blurb on the website. But you wrote a great article about where is contextual family therapy that's in family process right now, and I'll make sure that the link gets put up with this interview.
that's very kind. And I really thank you very much for your interest and your invitation because, without you, I wouldn't be on that tape. So thank you very much for the invitation.
Thank you so much for being here today, Catherine.